WHO modified Partogram. So here there is no latent phase. Second, in case of the vaginal examination, so here this should be done no less than every 4 hours. Every 4 hours it is used to assess the cervical dilation, and also there is a descent of the fetal head. Next, there is also the molding of the skull, which can be seen. Molding of skull bones. So more frequent it can be done only if there are certain indications. Next, if you see the charting starts at 4 centimeters. 4 centimeter of the cervical dilation. Next, looking at the color. The color, it starts, C is for clear, B is for the blood, next M is for the meconium. There is a concept of molding. So what is molding? Molding is basically the bones. There are gradings given. So in case of the bones are separated, and the sutures if you see, it can be felt. So this is nothing but 0. Next, if you see, the bones is touching. So in case it is touching, it is 1 plus. Next, if you see the bones, it overlaps. So it overlaps but reduced. So this, if you see, it is 2 plus. Next comes the 3 plus. So in case of the 3 plus, what happens is the bones, it severely overlaps, and it is irreducible. Next, we are looking at the alert line. So the alert line, it reflects the average rate of cervical dilation. Average rate of the cervical dilation, and this is of the slowest quintile of primary gravitas. So the slowest quintile of primary gravitas. And this is in case if the dilation slows. If the dilation slows or ceases. Next, the Partogram plot, it crosses the alert line in such cases. It crosses. So if you look at the alert line, the alert line at 4 centimeter dilation and the expected dilation of 1 centimeter per hour. So the action line is about 2 to 4 hours after the alert line, and it prompts the interventions to accelerate the labor or perform the cesarean section. So cesarean section as well as the accelerated labor can be done. So the higher rates of perinatal mortality. So the perinatal mortality, it is seen in case of delays of 4 hours or more after the alert line. The contractions are measured. The contractions are also measured. The contraction is measured, say about a span of 10 minutes and measured every 30 minutes. And measured also in 30 minutes. So 1 square is equal to half an hour. Next we are looking at the pulse. So if you look at the pulse, it is recorded every 30 minutes. And the mark with a dot, and it's marked with dot. Next, if you see, there is the blood pressure. So this blood pressure is recorded every 4 hours. It is recorded every 4 hours and it is marked with arrows. And unless the patient has hypertensive disorders or preeclampsia. So in case the person has the hypertensive disorders or in case of preeclampsia. So here it is recorded every 30 minutes. Then if you look at temperature, it is recorded every 4 hours.